Did you know that there is a body system that you were not taught about in medical school? In this video, I am going to introduce you to this body system. I am then going to explain why you were likely not taught about it in medical school and elaborate more on why it's so important for patient care that physicians learn about this body system. So, the body system you weren't taught about in medical school. I am Dr. Janice Makela. I'm a physician with over 20 years' experience in medical care. I am board certified in geriatric medicine, hospice and palliative care, and internal medicine. I'm a hospital medical director, and I'm the host of Q&A with Dr. Makela. I am also a physician educator. Doctors learn about many different body systems in medical school. We learn about the cardiovascular, the neurologic, the respiratory, the lymphatic, the immune system, the endocrine, so many systems. We learn all of these in detail during medical school. But there's one system that most doctors do not learn about. And it is a system that interacts with every other system in our body, the endocannabinoid system. Now, what is the endocannabinoid system? Well, it's the master system. The endocannabinoid system's main job is to maintain physiologic homeostasis throughout our body. It interacts with every other system. We have two main endocannabinoids, AEA and 2AG. And we have two receptors that these endocannabinoids act on, the CB1 and CB2. Other receptors and chemicals play a role in modulating the system, but these are the two main endocannabinoids and two main receptors. Now, where is the ECS in our body? Well, it's almost everywhere. It's in the brain and in the spine, fat cells, liver cells, the GI tract, the pancreas, muscles, lungs, heart, kidneys, immune cells, spleen, fat cells, bone, liver, heart, everywhere. And you can see that there's a little bit of a distribution between the CB1 and CB2, with the CB2 being more focused on the immune system than the CB1 is. And the CB1 has a little bit more focus on the neural system than the CB2 does. So now, if the endocannabinoid system is so important, why did no one teach it? Well, it was discovered fairly recently. It wasn't discovered till 1988, and researchers were actually researching THC to try to find what it activates to give people a high. And of course, they found the CB1 receptor. And they named it a cannabinoid, right? CB, after THC. 1992, they actually found the body's natural endocannabinoid that activates that receptor, and they called it anandamide, AEA. And then in 1993, they found a second receptor, CB2, and then a second endocannabinoid in 95, 2AG. And then in the 2000s, we started seeing a lot more description of the larger endocannabinoid system, other receptors that weren't technically endocannabinoid systems, but related to it and the things that modulated it. We learned more about the enzymatic pathway. We learned about how these were developed, and we started learning about what drugs actually worked on it. So we have a much better description of it than we did back in 1988. But it's usually not in medical textbooks, even though the ECS is now 35 years old. Now, another reason is name bias. And I think this is one of the bigger reasons. Because it has the name cannabis in it, and because it was first described while researching THC, its other functions in our body were not described until much later. As a result, there's a little bit of bias that people think that it has to do with people getting high, and people sort of miss the fact that it's an extremely important system in our body. Another reason is there's no new expensive pharma drugs right now. A lot of doctors learn drug mechanisms when a new drug comes out, a novel drug, through the drug company teaching them to them. And THC and CBD do use the ECS, and several older drugs are now known to use the ECS. And there was some attempt by pharma many years ago. They attempted to make a weight loss drug that blocked the CB1. The rationale being that if cannabis gives you the munchies, blocking CB1 might block your appetite. And while that did have that effect, it had a lot of really, really, really bad side effects that made it fail catastrophically. And so really big pharma has not looked into the ECS, though with more and more research and more understanding of it, that research is ongoing, and we likely will see more things to come in the future about the ECS. Now, why does it matter if doctors know about the ECS? Well, first of all, because many people use cannabis. And as we mentioned, cannabis, THC, activates the ECS by CB1 and CB2 receptors. CBD also works by a variety of different receptors that modulate the ECS. Understanding the ECS helps you better care for your patients who use cannabis. And you may say, well, I don't have a lot of patients who use cannabis. That's unlikely. And patients are often using but not telling their doctors. In a state with legal cannabis, in one study, 26 to 35 people reported to the people doing the study that they used cannabis for a medical condition, but only 10% of them reported it to their doctor. Furthermore, in another study, 7% of all people over the age of 65 are using cannabis. So the geriatric population using cannabis is increasing. Furthermore, it's integral to wellness. Cannabis is not the most consumed substance that affects the endocannabinoid system. PUFAs, polyunsaturated fatty acids, omega-3, 6, and 9, those are. They affect the endocannabinoid system directly. Now, several medications also work by the ECS. Many of the older medications are now being found to impact the endocannabinoid system. Exercise activates the ECS. We now know that endorphins are not the cause of runner's high. It turns out endorphins can't get into the brain to do that. We now know that it's actually endocannabinoids that cause the runner's high. ECS is implicated in several chronic conditions, neurologic diseases, metabolic diseases, autoimmune, cardiovascular. All of these have implications with the endocannabinoid system, and learning about that can help treat these diseases. Also, there are interventions that promote health that often balance the endocannabinoid system. Learning about it helps patient care. So, the ECS is the scientific basis for wellness medicine. So when someone's doing wellness medicine, you often see a lot of people do sort of vague hand waving explanations for a lot of different wellness interventions. A lot of times, this is actually the ECS that is responsible for these wellness outcomes. So a physician who can explain this to their patients has an improved credibility over someone who's just sort of hand waving about why this might work compared to, something else, right? The second reason that it can help your patient care, as we mentioned, is it can improve treating patients who use cannabis. So, again, you can help identify which patients may benefit from cannabis treatment. But even if you don't prescribe or certify for cannabis, increased understanding of the risk and benefits of using cannabis, so you can have a better conversation with your patients about cannabis use. And overall, learning about the endocannabinoid system will improve patient care and satisfaction.